Grand Bahama woman is speaking out tonight on her experience with the public health care system. She says the apparent lack of communication and information in the system poses life-threatening consequences for patients and needs to be rectified now. Aja Quant has her story.
Sharell Lockhart's journey to understanding exactly what is going on with her body began here at the Paris Plaza in February of this year. She returned in July only to find out that her paperwork was not ready. Now Lockhart is crying out for the critical restructuring of the public health system here in the country to improve digital communication of patients' information.
I have a son to live for. I have a mother to live for. I have a family to live for. And it cannot be like this, Miss.
Visibly distraught of the experience with the Public Health Authority, Lockhart, who suffers from cervical dysplasia, a condition in which abnormal cells grow on the surface of the cervix, says it is frustrating enough not knowing the outcome from her leap cone biopsy, and to top it off, her recent visit to find out if she has cancer or not turned for the worse.
There was absolutely no paperwork available for me.
Lockhart says the doctor apologized profusely, and while she says she's not blaming the doctors, she fears the potential delays in receiving the findings from a biopsy due to limited resources can lead to severe health risks for patients.
We have the best doctors and nurses, but we suffer from not having the resources necessary to get this information out in time, and for the information of patients to be carried across the system in a seamless way, so that no matter if I go to the clinic here at Paris Plaza or in 8 Mile Rock, they would have my files, they would know what's going on with me.
According to Lockhart, many persons have reached out with similar circumstances. She expresses that something has to be done and calls on the Minister of Health and Wellness, the Honorable Dr. Michael Darville.
Restructuring has to come from the top, so it is placed at the feet of the Minister of Health. And sir, I know you care. I know that you will try your best, but heavy is the head that wears the crown.
Now we reached out to the Health and Wellness Minister, the Honorable Dr. Michael Darville, who says he read Lockhart's story. He also says that the public health system, particularly the Rand Memorial Hospital, and administrators are very concerned.
I'd like to, first of all, apologize to Ms. Lockhart for the challenges we currently are experiencing. This administration is committed for the implementation of an e-clinical record throughout the primary healthcare system, as well as the tertiary, and to be able to integrate it all. So whether or not I'm in Freeport or I'm in Inagua, I can access my medical record through a digital platform. That is where we're heading. We have made some substantial steps to accomplish it. And I believe with this kind of digital platform in place, we can eliminate these kind of challenges that we have by physically moving patients' note from point A to point B.
For the Bahamas Tonight, the Northern Edition, I'm Aja Quant.